The Nigerian Association of Resident Doctors has handed the federal government a 10-day ultimatum to meet its long-standing welfare demand or risk a nationwide strike.
The ultimatum, issued after an extraordinary National Executive Council meeting held virtually, recently threatened to bring hospital wards and services across the country to a standstill by 10th of September 2025 if the demands of the doctors are not met. Joining us to unpack this morning is the Secretary General of the National Association of Resident Doctors, Dr. Odunbaku Kazeem Oluwasola. Thank you for joining us this morning on Breakfast Central, Dr. Oluwasola.
Thank you so much. Thank you for having me this morning. How are you doing?
Very well, thank you.
Thank you for asking.
Now, my first question will be, what are your grievances and what are your prayers to the federal government of Nigeria? And is there any reason why the federal government has failed to honor the promises made in earlier negotiations, despite your association, NARD's previous 3-week ultimatum, and repeated engagement with the representatives of the federal government?
Okay, thank you once again for having me. But before I go on to respond to that, let me use this opportunity to once again, on behalf of the leadership and all the entire members of the Nigerian Association of Resident Doctors, send our heartfelt condolences to the friends and family of a very promising and vibrant young resident doctor who we lost to death on over the weekend while he was on call duty, Dr. Femi Rotifa of River State University Teaching Hospital. And I also want to mention that it's quite unfortunate that apart from the fact that we are losing young, vibrant doctors to the Japa syndrome, we are a lot of doctors, young doctors, are also dying from preventable causes, especially due to the stress of work. So that being said, let me go on to mention that at our ordinary general meeting in May, we gave the government a false ultimatum, part of which was part of the demands rather were that the payment of MRTF, that's the Medical Residency Training Fund, for 2025 should be paid, and also some other arrears that we are being owed, including a 25-35 CONMESS review that was done sometime in 2023, and then another allowance of approximate allowance arrears. By July 2025, some part of the Medical Residency Training Fund was paid to some of the doctors, to some of the resident doctors. But as we speak to now, we still have a significant number of resident doctors who are yet to be paid the Medical Residency Training Fund. We still have outstanding 5 months salary arrears from 25-35% review. And then we also have outstanding accoutrement allowance arrears. In addition to this, we also still have some other demands, including the downgrading of some of our certificates by the Medical and Dental Council of Nigeria, and then the non-issuance of membership certificates after one of the postgraduate exams that we usually do by the National Postgraduate College of Nigeria. And then we also have some state governments who have also refused to meet the welfare demands of our members. Specifically in our communique, we mentioned the Oyo State government. We need to note that the Lautech Teaching Hospital Association of Resident Doctors have been on indefinite strike for over 9 weeks now. And up till now, the government of Oyo State, led by Governor Seyi Makinde, are yet to attend to their welfare needs. And also Kaduna State government was mentioned. Even though late yesterday evening, we got the correspondence from Kaduna State government signifying that they've started to attend to some of the demands. Later today, we are going to review all of those and then see if our members in that state would resume, because they also started an indefinite strike action at the beginning of the week. So these are some of the concerns that we have, and it's also very important to note that there has been poor funding of the health sector generally. And I followed your discussion earlier on the education sector, where you were talking about possibility of increasing funding to the education sector and all that.
Yes.
And I must say that it's even worse in the health sector.
I mean,
Right.
that's quite shocking because, I mean, health is a matter of life and death, and to not have it prioritized sends signals that are not palatable.
Yes, just like I was saying, you know, there is an Abuja declaration in 2001 where it was said in that declaration that at least 15% of all nations' budgets should be tailored towards the health sector. And as we speak right now, the 2025 budget of the country of Nigeria just has about 5% of the total budget being directed to the health sector. And that would explain why we have all these welfare issues, why healthcare workers are not being remunerated appropriately, why we are losing our best brains to other countries, why we are not able to even take care of the health of the healthcare workers. And you can agree with me, if those that are taking care of other people are not being well taken care of, then what are we talking about? So this is the sorry situation that we have in the country right now. And all we are asking for is for healthcare workers, especially doctors, to be well taken care of so that we can also take care of the citizenry.
Okay, I just want to go back to reiterate very quickly. You've highlighted what the concerns are. We've displayed them on the screen. Unpaid 2025 Medical Residency Training Fund, salary arrears and unpaid 2024 accrement allowance, delayed recognition and issuance of postgraduate certificates, that's MDCN and MPMCN, as well as neglect of welfares across the country. Let's start with, I want us to expand a little further on the delayed recognition and issuance of postgraduate certificates. Is this a regular occurrence? You know, how did we come here? And I'm asking this so you can help enlighten us. Oftentimes we've heard of situations where people go through the university education system and then they find out that the university is not accredited. Is that what is happening here?
So what happened is this. You know, we have a council, a Medical and Dental Council of Nigeria that is expected to regulate medical practice in the country. So as a doctor, you are registered with the Medical Dental Council of Nigeria, and all your certificates, whatever certificates that you get in the course of training or other form of education that you get, you are expected to register it with the Medical and Dental Council of Nigeria as added qualification to your MBBS. So we have some certificates, especially during residency training, membership certificates that are added to our MBBS, which is our first degree, so to say. So now, at a particular point, the Medical and Dental Council of Nigeria degraded or downgraded the certificates. So some of these certificates were in categories. So we have categories. There's category A, category B, category C, category D, depending on the level of qualification of those certificates. So we had some of the membership certificates that were supposed to be on a particular category downgraded to lower categories. And we've been asking questions, why? Why have these certificates been downgraded? Because what it means is that if I would want...
Hello, Dr. Oluwasola, are you with us?
Okay, we're hoping to reconnect with Dr. Oluwasola again to reiterate that the resident doctors have given the federal government a 10-day ultimatum, and this 10-day ultimatum deadline is September 10th. Today is the 2nd of September. The ultimatum began yesterday, the 1st. Dr. Kazeem, please go ahead with your statement. We're talking about the downgrading of these certificates and what the implication of that is.
Yes, I don't know if you got me at all. I was trying to explain some things earlier.
Yes, we got earlier. Where we lost connection was where you said some of these certificates have been downgraded without explanation, and then you were saying the implication of this is...
Yes, so the implication of this is that if any doctor who has any of these certificates that was supposed to be properly categorized, if we apply for something with it, we may not be able to get that because it has been inappropriately categorized. So for example, if I have a PhD, I'm just using a layman example now. So if
Yes,
I have
that's
a
okay.
PhD and it's supposed to be a category B certificate, and then it's now categorized as category D, and then it's now it lessens the importance or the significance of that PhD in whatever I'm used to apply for. So that's what we are asking for, that our certificates, our qualifications should be appropriately categorized. And then for the non-issuance of certificates, in the residency training program, we have 3 major exams that are being done. There's primaries, there's part 1 exam, and there's part 2 exam. So after the part 1 exam, there is supposed to be a certificate to show that you have completed that aspect of the training before you now move on to the next aspect of the training. But the National Postgraduate Medical College, which is one of the postgraduate medical colleges in the country, does not issue this certificate. And we're also asking questions like why. And this is one of our demands, that because we believe, especially because other postgraduate colleges that also administer the same examination give this certificate.
Now, Dr. Oluwasola, your organization has given September 10th deadline to down all tools if your demands aren't met. My question is, how are negotiations so far, and which stakeholders are you interfacing with in order to find a lasting solution to some of these issues you're dealing with? Because oftentimes when people hear about strike, they think it's just welfare related only. You just mentioned the issue of certificates. How have negotiations been, and are you of the opinion that from what you've discussed so far and you're interfacing with representatives of the federal government, you're likely to get a favorable decision that would avert this strike, knowing the implications on the health sector of the country?
Yes, definitely. We've been engaging all the relevant stakeholders, and just like you also mentioned earlier, this is not new. We've been engaging them since the beginning of the year. We've given several opportunities for the government to address these issues. At the point where it seemed like they were going to address some of it, or where they addressed some of it, we gave more time, and we didn't go on any strike at those points. But at this point, it's actually very important to note that yes, negotiations are still ongoing, and we can only hope and believe that the government will yield to our demands this time. Yes, we've been engaging different ministries, different agencies that are relevant to the payment of these arrears and allowances, and also other policy issues that we are asking for.
So what's the government telling? What's the government telling you? What message are you getting from the government's side? Are they saying there's no money?
They are working on it. They are working on it. They are trying to source for funds, all of those. But we believe strongly that if the health sector of the country is prioritized, then we should not be at this point. We believe strongly that if doctors and other healthcare workers are called essential workers, we should not be at this point. We believe strongly that if the government really takes the health and welfare concerns of every Nigerian seriously, we should not be at this point. We should not even be at the point that we have to give ultimatum before we get our demands. That's our belief. And we believe strongly that the government has the ability to pay all these funds. And we are looking forward to these funds being paid before the end of the ultimatum. Definitely, we are not strike mongers. We love our patients. We love everyone. We want people to come to the hospitals, and we want to attend to them because this is what we have sworn to do. But at the same time, we have also sworn to take care of ourselves, because if we do not take care of ourselves, there's absolutely no way we can take care of another person. So this is what we are just asking for. So the question on whether the government will do it before the end of the ultimatum, they will be the only one to answer that. But we know we are trying our best to negotiate and interface with the relevant stakeholders. And we know we have done our best, and we are still going to do our best before the end of the 10 days period. We only hope that the government will do everything they can in their own capacity to do the needful.
So, Dr. Odunbaku Kazeem Oluwasola, I completely agree with you in the area that doctors need to be prioritized, their welfare, and these demands are very valid. But there's also the concern of the catastrophic consequences in emergency wards. People, I mean, there will be emergency situations. There's a potential of people losing their lives if they don't have access to doctors. So how do we find that balance? What contingency measures is now putting in place to ensure that emergencies are at least being attended to and that we don't have, loss of lives as a result of this strike?
Yes, same. Let me start by saying again that this can be prevented in totality. It can be prevented. We don't even have to talk about, okay, when we now go on strike, how do we manage the emergency? This whole thing, this whole strike thing or industrial money can be prevented. And that is exactly what we want. We do not even want to go on strike at all.
So I think what I'm saying is,
thinking about manage emergency or not.
So let's imagine, worst case scenario, if this strike should happen, if the government hasn't responded before then, is there any contingency measure put in place?
I'm coming there.
Okay.
Yes, just like we are very responsible citizens. Even when we go on strike, we always look for a way to manage the situation so that the catastrophic consequences, it's not so bad on the average Nigerian. So we would sort all of this out when it gets to that point. But what we are asking for is that we would rather want this strike to be prevented. We do not want to get to that stage. So we still have about 8 days to that, and we believe that 8 days, or these 8 days that we have, is enough to address the minimum demands that we have put forward.
All right, Dr. Odunbaku Kazeem Oluwasola, Secretary General of the National Association of Resident Doctors, thank you very much for joining us this morning. Again, we want to share our condolences to you and the entire medical team. We hear of Dr. Femi, I think that's his name. I just want to double check. You talked about the
Dr. Femi Rotifa.
Yes, Dr. Femi Rotifa, who unfortunately lost his life. We hear that he was unwell and it was in poor working conditions, that he had asked for permission. Is that correct? That he had asked for permission to go look after himself but wasn't granted the permission. Is that the true position?
It was on, what we know is that it was on call, and other details we are still waiting for official statements from the management of the hospital. But we know it was on call, you understand. So I would not want to come here and say other details that may not necessarily be the facts. But we know it was on call and he was not feeling well. And we have also had several cases of other doctors who had passed away solely because of stress of work or poor working condition, or the fact that their employers or the government was not able to attend to their health needs. And this is quite unfortunate.
This again reflects the poor situation in our healthcare sector and why this conversation is important now more than ever. Please, we look forward to getting an update in that regard. Extend our condolences to the family and the entire Medical Association. Thank you for joining us this morning.
Thank you very much.